Live, broadcasting out to YouTube world. Thank you very much for joining, and we apologize for the delay in starting. We had some technical issues with Google Hangouts, so we certainly apologize for that. I'm here today with Brian Vardavedian, Dr. Brian Vardavedian, who is at Baylor College of Medicine, and also a judge for our Geneia Joy of Medicine Challenge, which is being run on MedStro. Looking out to all clinicians, physicians, and medical students around the country to submit ideas on how they can restore joy to the practice. We're also joined by Heather Lavoie, who is the Chief Operating Officer of Geneia, the sponsor of the competition, also who recently conducted the Physician Misery Index, which was a survey of physician job satisfaction. She's going to tell us the results, how that is playing out. I just wanted to quickly remind everyone that it's very easy to submit an idea to the Joy of Medicine Challenge. All you have to do is go to medstro.com/groups/joy. You can see on my screen now. We are really looking for all sorts of ideas. It doesn't have to be necessarily a product. It doesn't necessarily have to be something that can be piloted. Or we just want ideas for how you would restore joy to medicine. That can be in any. Can be in private life, it can be in practice, workflow, anything. So we really are open to all ideas. We'll be live tweeting today under the hashtag Joy of Medicine, all one word, and you can submit questions through Twitter, and we will answer them. So with that, I will hand it off to Heather Lavoie.
Great, and thanks, Brian, for being part of this challenge and for joining today. As Jim, as you mentioned, we commissioned a survey in January of about 400 physicians from across the country, and we, really emphasized that physicians were getting increasingly less happy with the practice of medicine, and really wanted to understand what was really driving that degree of dissatisfaction. Is anything we could help to do about it? Our perception was certainly validated by the results, and the overwhelmingly we heard back from physicians that no, medicine today is not what they anticipated when they entered, that the conditions to a certain extent have deteriorated, and in fact about in themselves, or they know of someone else who is likely to stop practicing medicine in the next 5 years. 84% of them said that the amount of time that they have to spend with patients has really decreased over the past 10 years, and 87% said, business and regulation of healthcare has changed the practice of medicine for the worse. So all of what we're doing, from a data entry to capture codes to get reimbursed, is really focusing on the not necessarily on the right things, which is care of patients. And we understand that about 8,000 individuals per day are turning age 65 because of the baby boomers really graying, and with that trending to happen for the next 16 plus years, our need for strong clinicians, strong physician leaders is only growing in terms of importance. And so we're at a critical juncture where we really can elevate the practice of medicine again, how we can retain physicians, and how we can really make this a meaningful experience for patients and physicians. And that's why we chose to partner with MedStro and host this Joy of Medicine Challenge to try to put physicians in the driver's seat, to get their voices heard, to get them a little bit heads up during the course of the day, and really create a dialogue around physician leaders, physician voices, and physicians as innovators. And with that, we really found that we've been able to get a number of strong submissions thus far. There's a lot of good discussion that's going on with the participants. Analysts. Submissions was a fairly low-tech idea that actually was incredibly relevant, and was the idea of a wallet card. Where a patient may have an ID that they can keep in their wallet that can get updated with each visit, but that has their picture and has their medications, and is sort of a low-tech intervention in a time where we're still waiting for interoperability. We talk a lot about it, we hear a lot about it, but we don't necessarily in that regard. And so it was a real pragmatic approach to solving some of the challenges of today, in recognizing that, you know, the future certainly holds, but there's some things really tangible that we could do right now that can really help to make practice of medicine easier for. So, you know, again, as Jim, as you mentioned, it's easy to and you get a lot of incredible feedback from some tremendous expert panelists like Brian. So I'll turn it over to Brian.
Thank you. I want to just echo how exciting it has been to participate in the Joy of Medicine Challenge. I want to thank Geneia and MedStro for inviting me along. It's been wonderful. Heather, the numbers are pretty staggering, and I know when I first saw that interview, or saw those results rather, I looked at it and I wasn't entirely surprised. You know, it was entirely consistent with what I see with my colleagues all around me. Increasingly, physicians are dissatisfied in the way that laid out, and that really is independent of institutional affiliation or where they happen to be practicing. So we really are. There's a tendency to look at those numbers and see them strictly from the perspective of doom and gloom, when in fact we really need to be looking at the opportunities that are really before us to sort of change things or turn things around. And one of the most remarkable points in medical history, and that we are so empowered to do so many things, right from our capacity to publish and share ideas on blogs and on the internet, right through to conversations like this that are happening on social networks like Metro. Development of apps and the easy ability for all of us to participate in change. And I think that's kind of come through pretty clear with the challenge. If you look at some of the submissions that have been put forth, they really represent the creativity and the capacity for physicians to jump in and be the kind of leader that you talked about just a moment ago. We truly, again, should be empowered with what we have before us. The submissions have been great. A couple of there was one that suggested the use of a screen on the board to be able to project an EHR so that a patient could participate in decision making. Certainly a time of the satisfaction that we have on a day-to-day basis. Mitch Abrams has a remarkable idea about a nonprofit social initiative that would bring doctors to third world countries during their vacation time to bring them back to their roots and serve the underserved in a way that everybody wins. I've been most impressed with the way that these suggestions have been really kind of all over the board and very creative. So if you've not participated here in just a moment, but you can participate, but have to be a real fully thought out idea, being kind of, or if you want to just participate in the conversation or comment on other people's ideas, that conversation is really valuable for all of us. But either way, we'll participate and jump in and put our 2 cents worth in, and excited to see what we come up with. Some real advantages to it. It's free, and you might win a bunch of money. I don't know what the cash pot is, Jim, but it's pretty good. I'd jump in if it were me. So.
Yeah. So just on that note, I will. There we go. For those of you who want to enter the contest, it's quite easy. And yeah, the prizes are, it's a $1,000 prize for the top 3, and then the opportunity to present their ideas live at a live event. We're going to announce this week when in front of an audience of your peers, and the top submitter at an additional $5,000 worth of consulting services from Geneia to help you turn your idea into a reality. So again, medstro.com/groups/joy. I want to either open it up for questions. That we said we would accept questions through Twitter, through the hashtag Joy of Medicine. We also, through the Google Hangouts, has a Q&A feature. And let me just go there now and see what we have. All right, so we have a first question, and that is, I guess for both of you, coming from different sides of this question, how is the dealing with the new requirements for electronic health records and meaningful use, and how that affects physician frustration?
Well, if I'm not mistaken, Heather, I guess under the study, 87% of physicians felt that a lot of their dissatisfaction went to this sort of administrative responsibility. Is that correct?
That's correct. Yeah, I think it puts it pretty front and center. And I think the intent behind meaningful use is associated with implementing it. It's really translated into doctors keying in the course of a patient visit to try to get recognition for payment and for services. We're certainly we want to make sure that we can measure for outcomes. Again, right reasons, right ideals. I think the way we've gone about implementing it is probably where we're particularly challenged, and that having doctors doing some of this work appropriate, where this really could very easily be handled systematically by other care team members. And I just think it shows sort of where we are in terms of the growth stage, in terms of IT adoption. We're really at the very early stage. And we're in digitization stage, and unfortunately, that digitization has fallen on the back of doctors, and which is really the wrong thing, altogether. And they're screaming about it.
I think the glass half full issue. When I look at my journey through with regard to electronic health records, it is easy to get hung up on some of the interface issues, some of the design issues that are clearly ripe for improvement. I also think back to when we use paper as a manila folder and benefits. I know a teacher within our office was using the Epic system. The next patient I go in to see is in a private office that uses either an independent system or is not connected with me. For that patient is completely different. It makes it so much easier to have that encounter and to have that information right in front of me. So I think there are some clear benefits that it's hard to see them put into adapting to this. I have a real interesting perspective in that I was raised in a paper era. And I will say it's also amazing, too, to see our residents and how they function with the EHRs and how facile they are. It's absolutely amazing. But it's been an interesting journey, and anyway.
Well, much as the business and regulation, they overwhelmingly also felt like electronic health records were absolutely and critical moving forward. So I think understand sort of the problem and the solution, but I don't think anyone is suggesting let's go, or maybe some, but overwhelming majority, no one's suggesting.
Yeah, no, absolutely. I think that in general, when we look at technology, it's replacing so much of what physicians used to do on their own, and I think one of the great challenges that we see with for me is the fact that we've yet to see the real benefit that comes from EHRs. I think we're collecting all this data, we've yet to see it on the downstream end impact patient care and other things.
Great. Yeah, I know the physician I talked to certainly has strong opinions on the EHR. Move the discussion in a different direction here. The physician job satisfaction situation that was uncovered in the survey. There are many different ways that we can affect satisfaction in our lives, and how do you think Medicine Challenge can help with that? Do you think we're actually getting ideas that sort of run the whole spectrum of different ways that we can restore, and if so, maybe mention a few of the ones that you thought were kind of outside the box ideas?
Yeah, we had this discussion when we were waiting to go live, and that was, what's going to be the real upshot from this? And I think that we need to manage our expectations with regard to this challenge, because we're now, but I think starting a conversation is really the first place to first place to begin. All the suggestions that have come through for the challenge, like I said, have been all over the board and have been very, very interesting. And I think that they, again, are getting us towards thinking about what we need to do intentionally to make our existence better as physicians, right from these very simple things that we can do in the exam room, like using a monitor, to broadly about managing our expectations. Sometimes our expectations are so high about what we will get and what we'll get from medicine. Sometimes adjusting those medications is one thing that we can do that's really healthy.
Ideas that I've seen actually surfaced up, there's a number of them that touch on this, and one, that was sort of, around the area of they raise the concept of slow medicine. And there's a number that talk about mindfulness and I think, you always hear physician myself, and some of it may be just endemic of society today, that everyone is feeling sort of overly pressured and busting at the seams and not managing stress, and for slowing things down, particularly physicians who felt like they're on this hamster wheel of churning through patients all day long, things down and have the right dialogue with patients. And that's one that, we certainly understand the benefits of meditation now, with sort of clinical evidence associated with it, and physicians sort of preaching it, but practicing it. And I just think physicians having a voice in policy and in regulation and in talking about what is right and what we do is important. So I agree with Brian, sort of managing our expectations about what ultimately will come out, I think is appropriate. I think just the dialogue itself is incredible, to give a forum for physicians to talk about this and get their ideas heard.
And I'll echo my previous point, which is actually have a lot more power to change the things around us that we actually think. Right from our day-to-day, again, as I suggested, right up to participating in some of the changes happening around us. Physicians we're so used to following. We start from our earliest pre-medical years, following the people who come before us and sort of walking in lockstep. So few of us are used to having our own ideas and coming up with solutions. We're just not given permission to have that kind of thinking. So it's a real permission-oriented field, and we have to kind of get physicians out of that mindset that they can go beyond just what's been laid out before them. They can come up with their own solutions, and we're seeing that, I think, with some of the suggestions.
Great. And we're hoping to get even more suggestions. There's still 2 weeks to submit ideas. I've left the URL up on my screen. Up until April 28th, you can submit an idea to the challenge, and hopefully you'll have a shot at one of them. I want to actually turn things back to last week. Everybody, the big HIMSS meeting. It's one of the biggest medical conferences in the world, I think, or having been there. What were your takeaways from HIMSS, specifically as it relates to physician workflow and what physicians can see in the future for them out a bit, whereas a lot of them feel like technology is just giving them more work to do.
Sure. I was overwhelmed. There were over 40,000 people in attendance, and every consumer product company you could imagine under the sun now has a solution for healthcare. And so, as a physician trying to wade through all everyone using the same buzzwords and is guilty of doing that as much as anyone else, but wading through is overwhelming and is certainly a challenge. There is no lack of solutions. I don't know that necessarily I saw a plethora of physicians. There certainly is an increasing role of chief medical information officers, so they're at least putting physicians in the seat, a decision-making seat as it relates to now. But I would still say, even when you look at the CIO gathering that happened on Sunday, it was just technologists directly and not necessarily, medical informaticists that come from a clinical background. And we're starting to see it tip, but certainly not as quickly as I think we need it to.
It's kind of evolved beyond just a meeting about EHRs. It's really gone a little bit more horizontal, hasn't it, to sort of in connected health?
Oh, it's an interoperability lab where you could see how
Right.
everything is interconnected. It was everything from direct telemedicine, bedside devices, solutions,
Right.
hardware, kiosks, tablets. I mean, anything you could imagine
Right.
related to health IT in attendance. And it went from, in a very short amount of time, from a very small industry. You could see sort of what happened with the incentives, related to high tech and the Affordable Care Act. How much focus has been placed on technology enablement in the country.
It's interesting that the American Telemedicine Association, I think, has undergone the same change in that the telemedicine meetings used to be just about this one camera unit where you sat in front of. It's moved into mobile and other elements too, and so it's interesting. I have to get to HIMSS. I've always said that I have no business being there, but
it's an overwhelming. If you want to see everything in one place, it is the place to go.
Honor. The EHR mogul was reporting on HIMSS, and he said it was like being at Vegas, on the Strip at Vegas, being on the showroom floor, because it's all these flashing lights, and he was wondering like who's behind it and who's benefiting from all this. And so it's an interesting. I have to get there at some point. So.
Well, I was to see Stanley, the tool company, actually has a population health solution, and so. Made Stanley, so legitimately it's strange bedfellows, yeah, but so you can see the intersection point of I think our worlds.
Yeah.
I'm just curious, what of the future did you see as a result of what you saw at HIMSS? I mean, where are we headed with technology, and how's it going to play a role in the future of healthcare?
Well, I mean, certainly there's much greater use of connected devices. They're still nascent, but it's absolutely the country's moving in that direction. So whether they're Wi-Fi enabled or Bluetooth enabled devices, and that data being able to capabilities, so determining earlier and earlier the onset of disease and/or decomposition in a patient. So I think one of the things that clearly the technology industry has heard is that physicians don't want everything outside the workflow. And so at least you have seen some more interoperability standards, the FHIR standards now that are coming out, where more will actually be integrated directly in the clinical record, so that there aren't all of these disjointed portals and ways of accessing information. That if we're going to make this work, we have to make it easier and easier for physicians. So that other area, and clearly, exchange of data, that we can't have these silos of data anymore, that if we can't on the same medical record, but islands of data exist any longer, it's harmful to everyone.
Excellent. Well, we're about coming to our 30-minute time limit. I'd just like to thank Heather and Brian one more time for me and sharing your insights with us. I want to, of course, one more time remind everyone that you can submit an idea to the Joy of Medicine Challenge at the URL you see on my screen now, medstar.com/groups/joy. Any idea is welcome, and all ideas will receive the feedback of our panel of online judges, including Brian Vardavidian, who's here with us today, and 11 other groups. At the least, you'll have a great conversation with some really smart people, and at the most, you'll win a prize and potentially get to. So, with that, again, I want to thank our guests and thank our audience, and hopefully we'll see you submitting your idea. Thank you.
Thank you.
Thank you.
Bye-bye.
Bye.
Bye.